Welcome to this deep dive. Today, we're tackling something really critical for long-term dental health,
Hmm.
especially if you're looking at options for, replacing missing teeth.
That's right.
Our focus, it's all about how dental implants play this vital role, maybe more significant than people realize, in preserving your jawbone structure after you lose a tooth.
Absolutely. It's something often overlooked. People see the gap, the cosmetic issue first.
Right.
But what's happening underneath with the bone, that has huge implications, not just for nearby teeth, but, well, for your whole facial structure down the road.
Okay, let's get into it then. We've been looking at some information particularly related to Omni Dental of Arlington Heights. They're at 305 E Rand Road.
Mm-hmm.
They offer a really wide range of dental services. And the practice is led by Dr. Bylis Poles, a DDS with, I think, over a decade of experience. General cosmetic preventive dentistry.
Yeah, and their expertise in things like dental implants really brings our topic today into, well, sharp focus. Because losing a tooth, it's not just about that missing crown, you see. The root, the part you don't see, that's deeply connected to your jawbone, it's essential for stimulating it.
And when that stimulation goes...
The bone just starts this process of deterioration. It recedes.
Okay, so this is where it gets really interesting. The stuff we looked at really emphasizes how critical this bone structure is. It's the foundation, right, for anchoring teeth, but also for maintaining your facial shape, how you chew, everything. So when a tooth is lost and that bone starts to, resorb? Is that the term?
Absorb, yeah, or deteriorate. Think of your jawbone like a muscle in a way. It needs exercise to stay strong.
Okay.
The forces from biting and chewing transmitted through the tooth root, that's the exercise. Without the root, the bone in that spot basically thinks, okay, job's done here, and it starts to shrink away.
And that affects other teeth.
It definitely can. It compromises the support for adjacent teeth, potentially causing them to shift or loosen. And like we said, as the bone volume decreases, it can change the support for your lips and cheeks, maybe leading to that sunken look.
Right, okay. So how do dental implants step in here? We know they act like artificial roots, but how does that actually mimic the natural function for the bone?
It comes down to this amazing biological process. It's called osseointegration.
Osseointegration. Sounds complex.
It sounds, but the concept is pretty straightforward. The implant, usually made of titanium, is placed surgically right into the jawbone. And over time, something remarkable happens. The bone cells don't just heal around it. They actually grow onto it and fuse with the titanium surface.
Wow, so it really becomes part of the bone.
Exactly. It's a true integration. Titanium's kind of special that way. Our bodies accept it, and bone loves to bond directly to it.
Okay, so you had this integrated post. How does that translate into stopping the bone loss?
Well, now this implant, fused with the bone, acts just like a natural tooth root would. When you bite down, when you chew, the forces travel through the implant and directly into that surrounding bone.
Ah, so the stimulation is back.
Precisely. That mechanical loading signals to the bone, hey, you needed, stay strong, stay dense. It keeps the bone cells active, regenerating, and prevents that resorption process.
And that direct stimulation, that's the key difference compared to other options.
That's the real kicker, yes. You've got alternatives like dentures or bridges.
Well, lots of people use those.
And they definitely restore appearance and some function. But think about how they work. Dentures sit on top of the gums. They might press down, but they don't replace the root.
Yep.
Bridges, they lean on the neighboring teeth for support, the gap underneath where the tooth was. That bone still isn't getting any direct stimulation.
So with those options, the bone loss can still happen underneath.
It not only can happen, it usually does continue, because neither option provides that necessary root-like stimulation. In fact, sometimes the pressure from a denture, especially if it doesn't fit perfectly, can even speed up bone loss a bit.
Okay. So implants are really unique in that respect.
They are.
Yeah.
When preserving bone is a major goal, implants are, frankly, the superior choice for that specific reason.
And the materials we review, they state this pretty clearly. Implants effectively prevent bone loss. Is there good evidence for this? Studies and such?
Oh, absolutely. There's decades of clinical research behind dental implants. You can look at long-term studies using x-rays, even more advanced 3D scans.
Right.
And they consistently show that the bone levels around well-integrated implants stay stable. Sometimes they even show slight improvement over many, many years.
Compared to areas without implants.
Exactly. Compared to areas with missing teeth or areas under bridges or dentures where you often see a measurable decrease in bone height and width over time. The visual evidence, the quantitative data, it all points to implants helping maintain that bone structure.
So it really supports the surrounding teeth and the whole jaw's integrity.
It does. It helps keep everything stable.
And this isn't just a temporary fix, right? The
Hmm.
sources emphasize this is a long-term solution.
That's the intention, yes. Because they integrate and provide that ongoing stimulation, implants are designed to last a very long time, decades, potentially even a lifetime, if you take good care of them.
So the benefit for the bone isn't just immediate, it continues year after year.
Absolutely. That longevity is key to maintaining oral health long term, preserving the jaw's structure, and hopefully preventing that cascade of problems that can start with bone loss, like further tooth loss.
Now we're focusing on bone preservation, which is huge. But the info also touched on other benefits, aesthetics, function, durability. Can you just quickly mention why those matter too?
Sure, while the bone part is foundational, these other aspects really impact your quality of life. Aesthetics is obvious. Implants are made to look and feel like your natural teeth. That's a big confidence booster for your smile.
Yeah, definitely.
Functionality is huge too. You can eat pretty much anything without worrying about things slipping or shifting, which can be an issue with, say, some dentures. It feels natural.
Like having your own teeth back.
Pretty much. And durability ties into the long-term aspect we just discussed. Because they can last so long with proper care, they often end up being very cost-effective over a lifetime compared to options that might need replacing or adjusting more often.
Okay, that makes sense. So pulling this together, if you're facing tooth loss, really understanding how implants work with your bone is, well, it seems essential.
It really is. It's more than just filling a space. It's about actively protecting the foundation of your oral health for the future.
That unique way they stimulate the bone.
That mechanism is what sets them apart in preventing those negative consequences of bone loss.
And for folks listening in the Arlington Heights area or nearby in the NW Chicago suburbs, it's good to know that Omni Dental, with Dr. Poles, offers these implant services. It's part of their comprehensive care, right?
Yeah, and they handle the full range: general dentistry, cosmetic work, preventive care. Plus, they do procedures that are sometimes needed before an implant, like bone grafting.
Ah, bone grafting. So what if someone has already lost some bone?
That's a great point. Bone grafting is where they can actually add bone material back to your jaw sometimes, using donor material, synthetic options, or even your own bone from elsewhere.
So even if some bone loss has happened, an implant might still be possible.
Often, yes. Advances like bone grafting mean more people can be candidates for implants and get those bone-preserving benefits, even if they didn't act immediately after losing the tooth.
That really highlights the importance of thinking long-term when choosing how to replace a tooth. It's not just about today's smile.
Exactly. Making that proactive choice, opting for something that actively maintains the jawbone, pays dividends for years in terms of stability, facial structure, and overall oral health.
So as you mull over what we've discussed, really think about those long-term implications. And for listeners in the Arlington Heights, Illinois area and those surrounding suburbs, Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, Elk Grove Village, Omni Dental could be a place to explore options. The number is 847-483-8833 if you want to ask more questions or discuss your situation.
And maybe a final thought for you to chew on, so to speak. We've talked about bone health, but what other aspects of your long-term well-being, maybe things that seem unrelated, might actually be influenced by this seemingly small decision of how you replace a missing tooth? It's a connection worth thinking about.